that mental health concerns carry a stigma about them, right? People struggle to understand that this is a legitimate health concern, how to go access care, whether they even should access care because they might be looked down upon by their family or their friends and neighbors. It's a messy,
it is
non-system.
Hi, I'm Jessica McCoy, and I'm your host here at Raising Midland, a podcast for parents in the Permian. Today, I am here with Russell Myers, who's the president of the Permian Basin Behavioral Health Center. Now, you're probably wondering, what is a behavioral health center? We'll get into it. He's also the former president of Midland Memorial Hospital, and he has a lot of different insights on what our community has done and will continue to do for our future of our city. Join me as I introduce my friend, Russell.
Thank
Hey,
you.
Russell.
Glad to be here.
Good. I'm so glad that you're here. You know, when I gave you a call, I was just so excited that you picked up because I just think you're just a Renaissance guy.
Oh.
You really are. You look at your bio that you sent me, and I'm like, man, what has this guy not done? So let's get into that.
Okay.
You went to Rice, and you've really been in hospital administration for a long time. So kind of talk to me about where it all started.
Well, it's an interesting story. When I finished at Rice, it was 1981, and people in the Permian Basin know that was a pretty bad time to be doing anything, right? And I grew up in a little town called Pasadena, Texas, outside of Houston,
Baytown.
which is close to Baytown, petrochemical. This is sort of the other end of the pipeline. We get the oil out of the ground here. We send it there to be refined and turned into chemicals, and my dad did that his whole life. But, my family didn't go to college. We didn't really have a lot of knowledge about what the future was. I had some potential. Always wanted to go to Rice. I had a grandfather that just told me I should always go there, but I didn't know what that meant.
Yeah.
So I did go there and got a degree in economics. And when I finished in 81, I just assumed the world would open to me, right? I went to Rice.
Right.
It didn't really happen that way. So I knocked around a little bit, and I was blessed to be with Kimberly, who she and I had been essentially together since junior high. And she had ambition to be a nurse, and she became a nurse, introduced me to healthcare through the process of watching her early work.
Wow.
And my first impression was, there's got to be a way to manage this better than what I see. Her experience as a young nurse was horrible, and I thought, this is something I could do. And so I went to grad school, and the story was written.
That is fascinating.
Yeah.
So you guys were technically middle school sweethearts?
Yeah.
That's so cool.
Yeah,
wonderful. Well, it's funny that you say Pasadena. I'm adopted, and my birth father actually still works in the refinery area in Pasadena.
Really? Yeah.
Yeah. So I understand that world. That's crazy.
It's a huge business and a really important part of the energy continuum.
Absolutely.
So.
It just goes to show you there's everything in Midland is either connected in some way.
Oh, yeah.
You can at least relate to somebody in some capacity. That's very interesting.
Right. Yep.
So you were inspired. I can imagine watching your wife go through her nursing school and her nursing certifications. I mean, that's rough. Can imagine in the 80s as a female nurse.
The work environment was tough. She worked on a medical unit where they had cardiac patients, they had people on monitors. And there were times when she was the only registered nurse for a 40-plus patient unit on an entire shift. And she'd have a team of, aides and such, but she was 20 years old and she was in charge. And that was fairly frightening.
Yeah, but also that is so impressive.
A pretty fast learning experience. She got up to speed really fast.
What do they say? Baptism by fire?
Oh, there's no question that's what it was. But it opened some doors to me. I didn't know how hospitals worked or really anything about healthcare. I'd been healthy all my life, and I didn't know anything about anything. But I began to get really interested, and there was a graduate school program at the University of Houston, which I could get into, and so turned into a career.
Well, what a great place to go to school, because you have MD Anderson.
Right.
You have the Baylor Medical Schools down there, right?
Medical schools there, right? I did my first healthcare job was at Methodist in Houston, and I did a fellowship there when my graduate school didactic work was finished, and so that was my original healthcare home, was Methodist in the medical center.
It's a great, healthcare city, that's for sure.
It is.
That's wonderful. So then what took you to come here? You're from Pasadena, and your wife obviously is from that area too.
Right.
So what led you to come to Midland?
Well,
Especially that wasn't a really good year for oil and gas.
Well, I didn't come then yet.
Okay, good. I would say, hold on.
There's a lot of history between here and there, but I worked at Methodist for about 8 years, left Methodist to join a new startup company that was called Columbia Hospital Corporation, which eventually grew into what is now HCA, which is the biggest investor-owned healthcare provider in the country. And I was with them for a total of 12 years. And as I got to the end of that time, I was realizing that while for-profit healthcare is fine, it's not necessarily ethically or morally lesser than nonprofit healthcare. It fundamentally serves the investor. If you work for an investor-owned company, the people you work for are the people who own your company, and they expect a return on their investment. It's not necessarily the community you serve. It's not necessarily the physicians that work in your facility. And I was hungry for that.
You were hungry for the community aspect, so something that was not a profit hospital. It was funded by
a place to have some control over the direction and to make a difference in a community. And so with that as the focus and not the secondary concern.
Okay, so that makes sense. I'm just not familiar with hospitals and how they work, but I can understand with the whole COVID situation really helps people understand how hospitals work.
Right.
And, we're not going to get into that. That's a separate conversation for another day.
A long one.
But I can appreciate, I can appreciate where you're coming from. When I was at SMU, I was a college athlete at SMU, and one of the things that I was trying to do during my time there was to get swimmers engaged and athletes engaged into working with nonprofit hospitals. So or at least hospitals that accepted a lot of their funding through supportive donors, and Children's of Dallas was one of them.
Sure.
And so I kind of understand a little bit of the logistics of that, but man, that getting into the hospital administration, it's my understanding that it's a difficult thing to crack into, but once you're in it, you learn so much. Kind of like what your wife did. She was thrown into, in the midst of a learning environment similar to what it seems like you were. So it sounds, from what I'm hearing from you, is when you were in an investor-backed hospital system, and you were really looking for something that seemed a little bit more caring of an environment, because I'm sure you can appreciate, I think anyone can appreciate, when physicians and nurses and hospital staff feel like they're supported, it's better outcomes for patients. Is that true?
That's very true. And I think the other thing was that I was looking for was local control. When you work for a corporation, any corporation, you're going to be driven by the priorities of the corporate office. And when our corporate office was in Nashville, so it was really hard for the particular needs of a neighborhood in the Houston area to be a top priority for people in Nashville who maybe hadn't been to Houston. So coming here, I had the opportunity not only to work in a nonprofit, community-focused environment, but also among people who were making the decisions. Wow. The only mission we had was to serve this community. And so everything we did was shaped in that way. That was very appealing to me. So that's how I got here. There was an opportunity here at Midland Memorial. They recruited me. I accepted it, moved my family here. And
how long did you work for Midland Memorial Hospital as the president?
Right at 20 years.
That's amazing.
Yeah.
Wow.
It's a long time. In our world, the average hospital CEO tenure is closer to 4 years.
Oh my gosh.
20 years is a long time.
Wow.
Yeah.
I can't imagine the things that you've seen. I mean, I've had conversations, I've been lucky enough to have conversations with some people that have benefited from the hospital at the board level and on the fundraising level. And they have told me that it has been such a transformation, and it seems like that must have been your whole career as president of the hospital.
Feels like it.
So what are some things that you're most proud of when you were president of the hospital?
Well, I think over that time period, we made a lot of change. We introduced a whole different culture to the hospital, which was, I'd like to think, much more open and much more caring for the workforce. That wasn't always the history there. Communication is difficult. There's a lot of people working around the clock. It's never easy to communicate in an environment like that, but we tried to prioritize that and telling people the truth, whether it was good or bad, and treating them as adults and paying them appropriately, and just trying to create an environment where our really rare incredibly valuable human resources were valued appropriately and were appreciated and felt like they were a part of something bigger than themselves.
Oh, we love that.
That's
awesome.
all sort of soft and vague, but that was a big part of what my time there was intended to do, and hopefully we accomplished that. At the same time, we had really old facilities that were in really rough shape. We had to raise a lot of money to change that. We built the Scarborough Tower in that time period, and we raised more money privately than anybody had ever raised for any project in Midland before this.
That's
and
amazing.
it was because the people in the community recognized the need and stepped up to help meet it. And that's really one of the most fulfilling things you could do
100%.
is to identify a need, make the case, and have people who have the means to help you step up and do that, recognizing it's got real value for the community.
What voices did you really pay attention to the most in regards to the driving forces behind that campaign? Because, you know, I have a minor in nonprofit management. So in my head, I'm thinking, okay, well, what are my key mission, vision, and strategy for when you were raising money to improve the hospital? Because you really have to think about your stakeholders, which would be your patients, your physicians, your staff, like everyone down to, you know, the people that are doing the traffic patterns. Like, you know,
it was in this case, it was really the whole community, because we were not only raising money privately, but we also had to go to the voters to issue the biggest bond, you know, borrow more money on the public's dime than we had ever done before. And so not only did we have to impress donors and get them to donate to the project, we had to impress voters, which is a much bigger constituency. And so the secret to that, as far as I know, was understanding our own story first. You know, we could pretty clearly articulate what the need was. It's the only hospital in town. Everybody needs it. The facilities were literally falling apart, and we could illustrate that in a number of different ways. We had a vision for how they could be better and what difference that would make to people day in and day out. And we clearly and concisely expressed that to the community. You know, if you write you can write a 20 or 30 page white paper on what you need, and nobody's going to read it. So you have to be able to distill your message to just a few key points that people can easily understand and that you can repeat over and over.
Yes.
And that everybody who's engaged with your project can understand and also repeat. I learned all of that. I've never done any significant fundraising in my life, but I learned all of that essentially from Roz Grover.
She's the coolest person. In case people who don't know, Roz is an incredible person in Midland. She, I think, has lived here for the majority of her life. And one of the things that she's known for, one is wearing her iconic suit jacket. That's like my favorite thing about her. Anytime you see her, she's got an awesome blazer on. But one of the things that she told me when I first moved to Midland, I wanted to work in nonprofit management. And she said, Jessica, I have to go back to what we did with the hospital. And she said, it's, you know, they may want to go to MD Anderson for cancer. They may want to, you know, go to the Mayo Clinic for some reason, right? And that's all well and good. But what happens if your kid has a 104-degree fever at night? Where are you going to go? The local hospital. Right. What happens if you're involved in a car accident? Where are you going to go? Not Houston. Right. It's about investing back into our community. And that's honestly what this purpose of this podcast is I think it's so easy for people to get on and online and say negative things about our community. It's another thing to think, okay, well, you know, it's one from the outside, you can assume anything about anyone or anything. But if you are really thinking about the practicality of giving back to the community, that's where you're going to see returns tenfold. Okay. And I really appreciated when Roz said that, because it just shows the importance of investing back into our community, but investing in ways that make the most sense. Investing into our community, for instance, the NICU, right? My mother-in-law was telling me that there were several Midlanders who were having, you know, their children were having children. It was their first grandchildren. And, you know, having access to a neonatal intensive care unit, especially at different levels. And I'm understanding, just like ERs, there's different levels of specialty, and that can impact mortality rates for this city.
That's right.
You know, and again, you may want to go to a specialist, but if your grandchild was just born and they need a NICU, I mean, that needs to happen now. And that's an immediate situation that needs, you know, that people need to be able to utilize. So let's get into that. It's my understanding that you were one of the pioneers and kind of, I don't know if that's the right word, maybe one of the people that were really advocating for the NICU to be built. Can you talk to me about how that came to be? How did that conversation start?
Well, I think it starts almost at the beginning of my time here. One of the things that I recognized early on was we were the only hospital in Midland County. We developed over the first few years this idea that our mission was to lead healthcare for the whole community. And that meant different things. That didn't mean we have to do everything, but it meant we had to feel responsible for everything, you know. And as that understanding evolved, I recognized there were a couple of things we just didn't do, you know, and that has an impact on the people who live here. If you have to leave town to secure some fundamental service, then are we really fulfilling our community service mission? You know, there'll be things we'll never be able to do. You know, we're not going to do repeat open heart surgeries, or you know, the highest end experimental cancer care. That's not realistic for our community. But there are things we can do, and we should do what we can do. Behavioral health is like that. We'll get into that later.
Yes, I'm excited about that.
But the NICU was really kind of at the top of my list there. What I recognized was we were delivering a lot of babies, you know, 200 babies a month in our facility. And every month, somebody would need, you know, multiple somebodies would need more intensive care. They'd have a premature baby. They'd have a baby with some issues that came up at delivery that needed to be addressed with a longer stay. Maybe they needed some oxygen support or things we just didn't do ourselves. It was conceivable that we could do them, but they'd been done in Odessa forever, and people had gotten into the habit of going over there. I first noticed that when we've analyzed this over several times over the years, and one of the things that really stood out was how many women intentionally left Midland to deliver.
Yes, okay, we were talking about that with the Iretons. We were interviewing a family who owns We Rock the Spectrum, and they were both born in Odessa. Because Odessa had the better hospital at the time in the 80s.
Well, they had greater capacity, and their doctor.
That's what I mean. I didn't mean to.
Well, better is relative, but it was better in some ways. And because their doctor in Midland was prudent, and looked at their condition and said, look, the safest place for you as a mom, and especially for your babies when they're born, is an environment where they can care for all of your needs.
That makes sense.
And you could deliver here. We do a lot of deliveries, and we do them safely, but people with high-risk concerns either get immediately transferred out, or the better scenario is for them to deliver there in the first place.
Yes.
So you don't have to put, premature babies in an ambulance on an urgent basis and drive them 25 miles to the west. So over the years, that happened, and that became really obvious in the numbers. There were a lot of Midland deliveries happening in Odessa. Well, why? Why should that be the case? This is fundamental service that people who live here should have a right to expect. And NICUs are hard. You know, they're hard to staff. They're expensive. They don't necessarily make any money. Sometimes they lose a lot of money depending on how you operate them. And we kind of walked up to that idea and backed off 2 or 3 times over the course of a few years. And then after we had raised the money successfully for the Scarborough Tower, we recognized when we were building it that we would do a NICU one day, and so we left space for it. And then we realized, you know, the community steps up when we articulate a need in an understandable way. People will step up and fund it, and so we said, look, this is another of those opportunities. So we went back to the community. We got, you know, the Wilsons helped us with that campaign. They were tremendous. They had some of their own experience to talk about as part of the process, and we really pretty easily raised the money it took to build the NICU and built it. And we were blessed that we had planned for it in the Scarborough Tower construction, even more blessed that people stepped up to pay for it.
Wow.
There's still more that can be done, and over time it's going to continue to evolve, but getting that fundamental service in place meant women could deliver here who had to leave town to deliver before. And the hospital now is delivering more babies than it ever has in its history. And that's a part of the reason. It's a booming economy, we've gotten young and all that, but it's also because we're more capable than we've ever been.
Yes. I'm going to give you a personal anecdote myself. With my son, he was failure to thrive. So around 32 weeks, I was really lucky to be Dr. Beverly Yee Whipple's patient, who I just think she's one of the most brilliant people ever. Having a blood clotting disorder is what I have, so I'm having to do shots twice a day for basically a whole year, because you do it right at the beginning of your pregnancy and then right after. So I'm going to be honest with you, I was terrified to deliver in Midland because, no offense, but I just didn't know what was available. And if it weren't for Dr. Yee, I don't know if I would have understood what all Midland had. So the way our protocol worked is, one, she's a specialist in my type of blood clotting disorder. She also connected me to Texas Tech physicians who also house out of the Midland Memorial Hospital through their hematology and oncology department. Then she helped me facilitate that conversation and have those doctor's appointments. Then my son started being at risk for premature delivery. And that's when a whole other level of scared happened, right? Because I'm sitting here, I know that I'm at high risk myself because of my health. But then also, I really thought we would have to deliver in Fort Worth because I wasn't sure how the hospital was going to be able to care for me, let alone
and for your child.
Another little kid, right? Who's also struggling with their health. So then that's when I learned that Midland Memorial has a really good relationship. It's the West Texas Neonatal Clinic right outside. It's right next door. I think I'm butchering probably the name of that, but because I was always billed through Midland Memorial, so I'm not exactly sure. But it's right next to the West Texas Food Bank. And these doctors would come in every single week, much like they do for some children's specialty clinics here. Doctors will fly in from other cities to help care for their patients. That set my mind at ease because not only was I receiving the health care that I would need, but also my son was receiving the health care he needed before he was even born.
Yeah.
And quite honestly, in the midst of a pregnancy, there was a lot of emotions with that. But it really set my mind at ease knowing that my preconceived notions of what I thought was possible in Midland were challenged during one of the most difficult times of my life because that was the most scared I've ever been. You're a first-time mom, too. That complicates it even more. Yeah. So just from a personal experience, I'm thankful that, the hospital truly, not only if they can't provide an immediate solution, they are going to ask the right people. And truly, I feel like that describes what Midland is. We're very practical people. Midlanders are. I think that we try to look for immediate needs first, also acknowledging that there are larger needs, right? So we're going to get into the behavioral health center here in a second. And I think what's beneficial for Midlanders to kind of think of positively is that just because a need is not being made now doesn't mean that there's not access to resources. And I think Midland is such an incredible place to be able to leverage communication so that if you don't have an immediate solution, there's going to be an immediate solution maybe in the future, and we'll try to connect you to the right people who can help you right now. So getting into that, right? So when I first had my children, my son, right after the birth of my son, I had postpartum depression and postpartum anxiety. For anyone who doesn't know, when you're first diagnosed, right at that first pediatrician appointment, they give you a sheet of paper and they say, "How's everything going?" And you're like, "I don't know. It kept the baby alive, I guess. I mean, I haven't showered in 2 days." That's pretty normal for most women postpartum. And let's be honest, most women and families in Midland don't have family here. It's a very transient community. I like to kind of compare it to military life, right? A lot of people are moving around. So it was really hard, even for someone who advocates for mental health awareness, much like I do. It was really difficult for me to even circle that I was struggling. So, we talk about what people may not know is that Mr. Myers is also the president of the Permian Basin Behavioral Health Center. And so let's get into that. knowing that, we'll get into the whole maternal health care in a second, but I want to first backtrack a little bit and ask you, what is the Permian Basin Behavioral Health Center?
Well, I referenced earlier the fundamental things that we didn't do yet.
Yeah.
Right. That sort of bothered me in those early years that I was here. Behavioral health is one of those, and this is not something I knew a whole lot about personally. I'd worked in a hospital one time that had an inpatient psychiatric unit, kind of operated on its own. I didn't know a whole lot about it. But what I recognized was really related to the emergency department first, that every day, or most days at least, about 20 times a month, a patient would come to the ER, and usually not voluntarily, almost always under arrest.
Wow.
And this became something of interest. We had to build in our new ER when we built the Scarborough Tower. We had to build 2 lockable, safe rooms for mental health clients. But I also knew we didn't have any services to provide them. They were showing up in our place in crisis, and our people. We put more and more people on this over the years to help place them.
Yeah.
They're in the ER. We keep them alive, much like with your baby.
Exactly.
All we could do is keep them alive,
simple.
and then find a place to send them that could actually give them the help that they need. And that, wasn't always successful. In fact, it often wasn't, because it would be out of town. They'd get minimal care. We wouldn't have a support system there, so they'd come right back to this environment, go right back into whatever cycle they were in, maybe get arrested again. And I always thought that was crazy. It didn't make any sense that there's a population whose access to health care begins in the back of a squad car. That doesn't make any, you wouldn't ask a person with chest pain to go get arrested before you come to the hospital. It's just ludicrous.
Yes.
And so back in 15, we had been thinking about this for a long time. We had a board member, Terry Wilkinson, who was engaged at the state level in the Department of Health and Human Services. She was a board member.
Wow.
Had been exposed to the Meadows Mental Health Policy Institute. Really great group of people based in Dallas.
Oh, yes. And by the way, if anyone wants to learn more about mental health and how to help others who have mental health struggles, they actually have a course that you can take through MHA, and it's mental health first aid.
Yeah, right.
And it's something that the Meadows Foundation has funded for several years, and you can actually take that course at Midland Memorial as well.
Yep,
So
that's right. So the Meadows folks have this whole institute within the foundation that is dedicated to the advancement of mental health care in the state of Texas especially, but it's gotten bigger than that even. And they do policy at the legislature, but they also help communities figure out how to address their own needs. And so Terry introduced us to them. We had them come in 2015. We did a comprehensive community analysis of our mental health system, such as it was. And the Meadows folks drove that and talked to a lot of people in the community, got a really good picture of what we could do, and it was pretty limited. We had people here doing things, typically smallish nonprofits like Centers for Children and Families or Agape Counseling. They were serving a small niche. They had limited funding, limited resources in terms of personnel. And we were maybe serving 10% of what we perceived the need to be. That's not acceptable.
yeah,
But we also recognize that mental health concerns carry a stigma about them, right? People struggle to understand that this is a legitimate health concern, how to go access care, whether they even should access care because they might be looked down upon by their family or their friends and neighbors. It's a messy,
it is
non-system.
Then you add in, societal pressures as a parent, right? Even fathers too.
Sure.
Like fathers can also experience depression and anxiety after the birth of a baby, or in the type of work environments that we have here in West Texas. People talk all the time about addictions, and we're lucky to have resources like the Springboard Center.
Right.
But I think I would be remiss to not mention that, mental health care for families can also involves fathers too.
No question. Yeah. Probably if you go to Springboard, they're much more male
100%
there than female.
I think when you're having a conversation with a family member where you're concerned about their mental health, we're looking at what does the culture of that community accept as normal. And I appreciate you challenging the preconceived notions and actually having someone break the ice for our community, much like the Meadows Center.
Well, and that's part of what we learned in all
Yeah.
that process was people didn't understand what was available and how to understand what their own needs might be.
Well, if we're not talking
and
about it, how
that's
can we
right,
understand?
We can't talk about it. Or when we
right?
do talk about it, we make fun of people or we ostracize them for admitting that they're less than perfect. You don't ostracize people
God
because they have
forbid
diabetes.
you be not perfect. I
Yeah,
know.
right.
Like if you
I mean,
have
it's
diabetes
just-
and you need insulin,
It's a big part of the Meadows folks had a lot of ways of talking about this, but I can still visualize this chart we used in raising community awareness that showed the different paths for someone that's somebody who's got a chest pain versus someone who's got a mental health concern, and one of them goes to the ER and gets doctors to care for them in their specialty, and the other one gets arrested because they acted out in public or they threatened suicide, and those paths should converge. They shouldn't be radically different like that, and so. Our early work after the Meadows study was just about building awareness and hopefully reducing stigma. We put a little nonprofit together. It had a lot of community leaders involved in it, and its whole job was to raise awareness and educate people. Now, this is a real health concern, just like anything else that you might have, and it deserves to be treated seriously, treated with appropriate resources, paid for by
Yes.
payers. All of that, and there's no reason it should have any different stigma from any other disease state. And we made a lot of progress on that over the years, such that when we got to about 2020, we began thinking, people understand this. There's a lot of support for doing something about it, which has got to be big, as we do so little. Maybe this is a project we can put together and people will step up and fund.
what a year to do that in.
Yeah, it was,
'Cause
the timing was a little interesting.
I know the sarcasm is very thick today.
2020, of course, is COVID year, and life was really challenging in those years.
But being a parent, I mean, during 2020, I had a 2-year-old. My husband was working at home. I was working at home in recruiting.
Yeah.
Who's getting hired in 2020? It was not a good year to be a recruiter, that's
tough
for
time
sure.
to do that. That's right.
And then also, I was pregnant with my second child.
Yeah.
Much like other parents, I feel like parents that have similar ages children as me, and I can imagine if people who have children in high school during that time, in middle school, it's almost, let me give you a good example. Parenting in 2020 felt like you have a sieve full of sand. And if you know anything about sieves, there's little holes in it. And it felt like you would be trying to hold on to sand with a sieve.
You just can't do it.
You just can't.
Yeah, that's
Everything just kept falling apart.
That's right. And there's no question that timing is not coincidental. COVID exacerbated. I mean, we had big problems already that we didn't talk about, we didn't understand. COVID made them worse, but the best part, if there was a positive that came out of COVID, I've said this to a lot of people over the years, it's that we suddenly became aware of the mental health challenges that we all face.
Yeah.
And willing to try to do something about it. Because it was really overtly affecting everyone.
Yeah.
It was in your house. It was with you every day. We think, you can't have hard numbers, but we think somewhere around 1 in 3 people has a legitimate mental health concern. And those numbers have gotten worse.
Well, when we're faced
since
with
the
our
COVID
mortality
period.
and
not only our mortality, but our
Stresses
loss
of life.
our loss of social structure and interaction, being confined in your home with people that you love, but you don't expect to spend 24 hours a day with.
no joke.
Those whatever underlying concerns there might be get accelerated, and so. The great thing about that is it made people more aware and probably more ready to do something about it.
Right.
So in 21, we had built a business plan to do something big about behavioral health. And one of the elements of COVID from the federal government's perspective was these stimulus programs or COVID recovery programs. One of those was called ARPA, the American Rescue Plan Act.
Ooh, interesting.
The federal government invested $2.1 trillion, as I recall, spread the money around to states and cities and counties and said, use this money to recover from COVID. It sort of wasn't really no strings attached, but it was pretty vaguely defined use. And one of the things that was in the definition was behavioral health concerns.
Interesting.
Here's a big opportunity for us, right? The state of Texas has $16 billion of that allocation. Haven't figured out what to do with it yet. So in the 21 legislative session, we got with Tom Craddock and Brooks Landgraf, and we went to the legislature and said, please give us some of that money. We have a plan for a behavioral health center to directly address this top of mind concern that's come out of COVID.
Yeah.
And legislature gave us $40 million.
Wow.
We thought it was about a $90 million project at the time. So that's a big chunk of the money it would take to build it. And we said, great, we'll go do it. And we started raising money and, built a design and got land donated from Diamondback, which is tremendous.
Oh, I didn't realize
the
that.
Land, the 54 acres we sit on was a donation from Diamondback.
Wow.
And we raised a lot of money really fast. We've now raised about $85 million toward this project. The state in 23 gave us even more money to make it bigger and to do more things than we originally planned to do. So we now have a $230-ish million project under construction, and all but about $10 million of it is funded. So it's pretty huge.
I can't even conceptualize. Sorry, I know you're an econ guy and like you're a math guy, right? Like me, the arty kind of gal, I can't even conceptualize how much money that is. Like that's so much. What a blessing.
Huge blessing.
Okay, so break it down for me. What does this look like? Are we, because like, no offense, I feel like I'm going to call the elephant in the room. I know I prepared you prior to me asking this question, but whenever I think of a behavioral health center, just maybe it's because I'm projecting because I've struggled with depression and anxiety in my life. What I'm thinking is, okay, are we just throwing people in the hospital and locking away the key?
Well, sure. Yeah, I totally get that. And if you're not as old as me, but if you were, One Flew Over the Cuckoo's Nest would have been an important part of your youth.
Great movie.
And it's people locked involuntarily in probably a state hospital where they're abused and some of them die, and it's horrifying.
Yeah.
It's just the worst possible thing you can imagine. That's not what we're talking about.
Great.
In fact, that's a really old conception of what behavioral health used to be like. We could go on and on about this, but I could take you back to the 60s, the 50s and 60s. We routinely locked people up.
Well, yeah,
who had mental
we were
health
also
concerns.
medicating mothers and Mother's Little Helper to help
there was
them.
all kinds of really,
all those things, but
really,
exactly.
obsolete.
So things were
thinking,
way more. At least it's my understanding, because I've had to do some research, obviously, to prepare for this interview. What I was learning in my research was in the 50s and 60s, because mothers couldn't talk openly about their depression and anxiety, they would go to their doctors and they were prescribed usually something that was called Mother's Little Helper. It was an amphetamine tablets that would basically help them get through the day. And I'm
these
glad
were not psychiatrists they were seeing. They were family doctors.
They were family
obese,
doctors.
right?
But at the time, it was the only resources that doctors had. So how
they didn't understand postpartum depression at that point. And if you had, and you only really got treated for mental illness if you were really severely psychotic.
Yeah.
And then you got locked up. And in the late 60s, we had about 500,000 people nationwide who were confined permanently in behavioral health institutions, where that's what they got. That was the picture that Ken Kesey wrote about in One Flew Over the Cuckoo's Nest. The Kennedy administration, the last bill that John Kennedy signed before he died was actually the Community Mental Health Act. And
what is that?
its purpose was to effectively close most of those beds and repatriate those locked up people to their communities and to establish community treatment centers where they get care close to home. Well, they succeeded in closing most of the facilities, or at least limiting their capacity, but they didn't follow through on the back end and create the systems. And so what that created was the homeless people we have now all over the country. Many of those people would have been locked up in the 50s because they have an untreated mental health concern. And it also created a pretty substantial crime rate. These are people who will commit crimes because they've got an underlying untreated mental illness. And so they're filling our jails and they're filling our streets with homelessness. That's our reality now versus the locked up reality we used to have. Neither of them's good.
I would love to pick your brain about the prison system some other day, but that is it's incredible. Like, I didn't realize everything was so interconnected. So in my head, I just want to pause here and ask. So we're helping the most extreme cases with this behavioral health center, right? And like ideally, the systematic, progress with that is to obviously might potentially reduce crime rate in Midland and Odessa. I know Ector County is also involved in this project as well.
That's right.
So, but what about the people that are in between, right?
Yeah, this is not what we're building. Is not a state hospital.
Okay,
it's
cool.
not a place where people are going to be committed for life.
Okay.
And we're going to deal with some severe mental illness without question, and there'll be people who have to stay with us for maybe a couple of weeks on average. But what we're really intending to build here is a complete, comprehensive system of care that deals with, the majority of people we will treat will be outpatients. We're helping Texas Tech expand its psychiatry program so that they can see more patients. We're bringing more counselors and social workers and psychologists to the community. We're going to have outpatient programming, both for people who have been in the hospital and need a step down, a transition to the community, but also people who never need to be hospitalized. They just need a little bit more intensive involvement with a caregiver.
Let's talk about that.
So we'll have all that available.
How is Texas Tech involved, and how is UTPB involved?
Texas Tech has a huge involvement. It may not be well known, but for several years now, Texas Tech has had a psychiatry department based in Midland. They're actually training psychiatry residents, so we're making new psychiatrists. And it's still fairly early in that program, but it's there. We're training as many as 16 at a time.
Wow.
We're in varying stages
That's
of training
a lot.
to become psychiatrists. They'll graduate 3 or 4 a year. And they need a place to work, and the hospital will be that very much. But Tech doesn't have enough resources to meet all the needs here. So we're working together with them to grow their capacity. And we've got some local philanthropic funding to help do that because there's a cost to recruiting new docs and bringing them on board. So we're trying to grow their faculty at Tech from 2 psychiatrists to 11.
That's amazing.
By the time we open the new hospital.
And they will reside and work at at the Permian Basin Behavioral Health Center?
We are building space on the second floor of the Behavioral Health Center that will be their offices.
Wow.
So they should have a massive amount of outpatient traffic, seeing psychiatrists, seeing counselors.
That's wonderful.
On the second floor of the building that houses inpatients, but in and out for outpatient care. Everybody from people with really basic anxiety and simple depression and
eating disorders,
fundamental needs that can be met with an ongoing counseling relationship, all the way to people who really are needing medication management and may need to be hospitalized for a while to get stabilized. The whole continuum is what we're trying to address here.
Wow.
If it were just a hospital, just an inpatient environment, it wouldn't really be serving the community. It'd be serving a really small slice of us who have an acute illness. Most of us have some level of need, and it's that most of us that we're hoping to make the biggest difference with, and maybe over time make the inpatient care less needed, less essential.
More safety nets.
If we treat people on the front end, no different from if you're a diabetic.
Right.
If we're managing your diet and your insulin intake, and you're seeing your doctor regularly, then you don't ever have to come into the hospital, and you don't ever have to lose your eyesight or have your foot cut off. It's a similar concept.
I have to stop you right there because that sounds very similar to the Permian Basin. Lots of acronyms here. The Midland Memorial Hospital Health Week. How it sounds just like a similar program, because what the hospital does every year, if you're new to Midland, is they do basically a whole week where they talk about, we're going to talk about weight management. We're going to talk about mental health care. We're going to talk about, what pediatric services our hospital is able to provide. They also give you a dietary plan and helping you get back so that you can prevent type 1 diabetes.
They do some basic screenings
or type 2 diabetes,
to see if you. And a lot of people don't go to the doctor routinely. If you think you're generally healthy, you're probably not seeking care. You might have an underlying disease that you don't know about,
or you might not
could be
know.
managed. That's exactly right.
Or you might not be aware. Especially, I'm just thinking mental health wise, because it wasn't until my best friend. She's a therapist, and she specializes in mental health care for women and for teenage girls. And she said, hey, I'm really concerned here. And I didn't even know it. that I was suffering from depression
She was
after the
observing
birth
you
of my
and
daughter.
she could tell.
My son.
Yeah, that's,
and I was like, oh, for somebody, I mean, I've taken the mental health first aid class. Like, I'm a CASA advocate. They also teach you about that.
Sure.
So, I mean, I thought I would understand what that looks like.
but self-diagnosis is
100%.
nobody's strength.
I thought Wikipedia could help me. No, I'm just kidding.
No, that's right. You can
WebMD.
help others, but it's hard to help yourself. And,
It is.
And we all suffer from that one way or
100%.
another.
And also denial. Like,
That's right. That's where you start. Right?
you know. So I think that's wonderful. So another thing I wanted to bring up too, and I don't know if you can speak to the programming side, but one of the things that I've learned in the recent years, just with like being a mental health advocate myself, just with the education that I personally seek out, working with children, it's important for me to understand, you know, how to at least spark conversations with parents. Well, one of the things I'm learning is that addiction is a mental health issue, like eating disorders are a mental health issue.
Yep. That's right.
Depression and anxiety, that's not everything. Like, I didn't realize that a lot of because an eating disorder is a disease. An addiction is a disease.
Right.
Just like, you know, any other disease that you would have. So what kind of programs, I'm not sure if you guys have gotten into the weeds so much about what your programming looks like, but what does that actually look like? What kind of programming are you guys going to offer?
It's early still. We're still over a year away from opening, but you know, we're really blessed to have Dr. Stephanie Caples on the team. Stephanie is a licensed clinical psychologist. She's worked in this community for about 15 years or a little longer. And she has a really broad vision for what we need to be doing. She understands it. She's a mother of 4. She has a really strong understanding of the process that women go through during and after a pregnancy, and a real intensive interest in that particular field. We expect to have specific programming for new mothers, for women specifically. We'll have a lot for children, both on the inpatient and the outpatient side. We know that testing children is a really big challenge right now. It's hard to get that done here. We'll enhance our testing resources, so if children have issues, they can get into treatment early.
Wow.
The tech program is also training psychiatrists who will be board certified in child and adolescent psychiatry.
Developmental psychology too?
Not developmental.
Okay.
Developmental is a different story and a lot harder.
So I know Lubbock has a huge developmental psychology program.
It's a big challenge because there are not many people who are
it's very
attracted
specialized.
to that.
Like
Right.
That's like very specialized.
Child and adolescent psychiatry is dealing with the mental health concerns of children.
Okay.
Developmental pediatricians or psychologists are really dealing with development delays and concerns, the intellectual development or the IDD population. That's much harder. It's not paid very well.
Yeah.
That doesn't attract many people to it. So we have hope about that as well, but we're not as sanguine about our opportunities there as we are in child mental health concerns. But all those things will be built over time. And I think one of the things that's most exciting, which we'll actually be able to establish sooner than the Behavioral Health Center will be ready, is a fellowship program that we're working on that will actually put mental health resources in primary care practices.
Okay, talk to me about that.
Yeah, this is one of Stephanie's brainchildren and something she's really passionate about. You asked about our relationship with UTPB earlier. University of Texas Permian Basin has a master's level program in psychology and one in social work, and they're kind of parallel. They have a lot of commonality, but they're a little bit different. In both cases, when they finish their school, they finish their master's degree, they can't get licensed in the state of Texas until they do an extensive period of clinical work, postgraduate but not yet licensed. And for the most part, you can't bill for that work. So if an agency hires a future licensed counselor who doesn't have a license yet, they're just paying them for work that the agency can't get paid for. Very difficult for them to do that because they all run on a shoestring. And so we've put together some philanthropic funding again to help support people in going through that process. And the fellowship idea that Stephanie has put together actually puts them in primary care practices. So a newly graduated licensed counselor could go work in a family doctor's office or an obstetrician's office and see patients side by side with that doctor. Those patients are in their practice every day now. Those doctors, Dr. Yee, happen to be particularly advanced, but the typical obstetrician sees those patients, understands they have a concern, but isn't really equipped to deal with their concern.
Well, yeah, their
doesn't
patient
have time,
load.
doesn't have training. All their other patients are demanding their time. If we can put a resource in their office to whom they can hand off that patient for counseling, testing, even interaction with a psychiatrist who's off-site that could help manage their medications, that's a huge gain for that primary care doctor and for the patient. It also helps to remove the stigma that patient has.
100%.
If you're going to go to your obstetrician, nobody's going to criticize you for going to your obstetrician. If you can also get mental health services, which you might have been a little hesitant about, but you can get them right there in the office and you only made one place, then it's a game changer for you.
100%.
You're much more likely to get what you need when you need it.
Yes.
And stick with it.
There's something to be said about that too, because, it's what, and I can only speak to my experience myself, it's one thing to get a piece of paper and circle what number you are. Do you strongly agree?
Right.
Or do you this doesn't apply? It's another thing to go and sit in your car prior to going into a psychiatrist's office. Then you have to sit in the lobby and you have to then sit in the office and be like, I can't believe I'm here because I have anxiety. As a former athlete, and anxiety and depression as a former athlete is a hard pill to swallow, because when you get to the level of college sports, you're told to suck it up.
Right.
And, put your nose to the grindstone. It's not that bad. This is how we build stamina. That's what I was telling myself.
Sure.
So to be able to go into an office and where I'm already getting care.
Yeah, it's a safe place.
It's a safe place, but it also helps make it an understanding that this is still part of your postpartum care.
Right.
And there's also a lot of women who take antidepressants when they're pregnant too, to prevent postpartum depression, because you're most likely to have postpartum depression after you have the baby up to 1 year. And a lot of people don't realize that. It's not just the baby blues. Sometimes it can happen around the 10th, 8th month of postpartum. So if you're able to reduce that barrier, you're retaining those patients that would maybe not have sought care, because it's not only a stigma that they may, it's hard for them to even get there in the first place because they have to talk themselves up into it. And then also, let's talk about the struggles that parents have to, if you're by yourself here, the struggles to even find childcare so that you can go to a doctor's appointment. There's a lot of doctor's offices, especially psychiatry places, psychiatry offices that won't allow children.
Yeah.
So, that's a whole other level of complicated. If you're a mother who doesn't have childcare, or if you're a single dad, and you have your kids 50% of the time, it has to be accessible. So will this new behavioral health center, how are y'all thinking about the family? Because I'm just thinking of family of mine who are single parents. It's going to be difficult to basically say, it's one thing, hey, you need help. It's another thing to be able to say, hey, we can't watch your kids, so figure it out. You see what I'm saying?
Yes.
We have to be able to make it accessible for parents. And I understand, for one thing, going into primary care physicians, that's a wonderful resource. But what about if somebody needs additional care and they actually have to go to the behavioral health center? How are we making it family friendly so it's accessible for more families?
Well, there's a lot that we will do along those lines. What we're intending to do is make it available and accessible to everybody.
Mm-hmm.
Right? One of the great revolutions in medicine really was pioneered in psychiatry, and that's telemedicine.
Okay, so y'all are going to offer telemedicine?
Tech offers it already today.
Wow.
And we'll expand upon that, but there's a lot more that can be done. I'm not a big fan of an initial visit via telemedicine.
Yeah.
We've talked a lot about whether that's appropriate or not, but if you can get yourself established with a counselor or a psychiatrist, the follow-up care is very effective via telemedicine. So, if you can squeeze out the first hour to spend with your psychologist, or to spend in getting your medications right with your psychiatrist, we may be in a position that you can only have to see that person a couple of times a year in person, and the rest of your follow-up can happen via telemedicine. It's a very effective tool when you're not operating on people. You're not doing physically engaging things. but interaction like we're doing can be done almost as well via video
Wow.
as it can be done in person. And so that's going to be a big part of what we do. It doesn't eliminate the need for in-person care, but it supplements it. And it makes it a lot easier for people whose schedules are challenging, who maybe work away from home. There's no reason why if you're living in a man camp and
I
you're
was just
stuck
about
there
to
for a
say
week at a
that.
time, you've got your iPad. You can have a psych visit in your little room in the man camp.
Because I'm serious. Because
It
like
works.
my husband, with his first oil and gas job, he was out in a rig in New Mexico, and this was when I was pregnant with my son, and I remember going out there one time just to see him for the first time in like 2 weeks because they were on a fishing job, and it was like their record long fish job for that company that was doing the fishing, and it took a very long time. I think it took 31 days for them to get it out of the hole, which is a very long time.
Yeah, it is.
For everyone who's a fisherman, y'all are great. I also don't know what I'm talking about. I just know that this happened, and I was just so surprised that there were so many guys on location, and I couldn't help but think it's so isolating. And being out in the desert, that's one thing. Being out in the desert there's lots of stakes, millions of dollars at stake for a well going right or wrong. I mean,
and you don't have the family support
yeah,
system.
you don't have the family support.
Men don't like to acknowledge that they need that.
No, but I think that's
it's very
important to
real.
talk about.
That's right. If you're away from your family, and so many of the people who live and work in and around Midland and throughout the Permian Basin, which we intend to serve the whole basin, they're maybe hundreds of miles from their wife and kids, and that's tough.
It is.
You don't have somebody who cares about you to come home to at night. You don't have somebody to talk to about your concerns. You're away from your friend group. You're pretty isolated, and that's when we have some of the worst problems with addiction-related behaviors and the consequences of those. And we have super high levels of traffic accidents and deaths on the roads. Those are related in many cases. All that ties together. So anything that we can do that can tie people into a resource that can help them through those hard times, we want to be sure we can do. Telemedicine is a great tool for that.
Yeah.
But it's not the only tool, and it works
Right.
as a part of the whole continuum. Easy access in your primary care provider's office, more accessibility of all different kinds of providers when they're needed, telemedicine to do follow-ups. We'll have an emergency center, what we call a crisis intervention center, so you don't have to go to the hospital ER if you think you're in crisis. You can just show up at our door, and we'll sort you out and get you on the road to whatever care you need.
That's awesome.
Or you can call us. We're hoping to be the place to teach the community that if you have any concern about your mental health, you can call us, you can show up at our door, we will help you through it.
There's
whenever you need it.
There's many cities. I know Dallas is considering this. Because if you were having a mental health crisis, and just so y'all know, it's not as I've just done a lot of research, and I've been trained to recognize signs of mental health crisis in others, and a lot of the times crisis does not look like it does on TV.
Sure.
It's not. It's for some very severe cases it is very serious, but for others sometimes it's whispers in that.
Right.
That it's just a different person within who this person is who is having a crisis. So what do I mean by that? Sometimes it's not as obvious.
Right.
And I think what's really important is to be able to have city support. And a lot of cities like Dallas are considering, not having people call 911 like they used to. And now they're, reinforcing additional support services so that, what do they call it? I think they're like peace officers, and what they do is they go out, and their job is to make sure that you're safe, and hopefully the crisis can be de-escalated.
And we've got, our sheriff's department, for example, has trained mental health officers, but they're still officers.
Yeah.
And the more advanced communities, San Antonio does this, Houston's doing it to a great extent. They will do ride-alongs with a counselor, a social worker, a qualified mental health professional who can be the first line of intervention with somebody who's not threatening somebody else's life. I mean, if somebody's waving a gun around, the police have to deal with that.
Yeah.
Right. But if they're making threats, if they're barricading themselves in their house, if they're doing things that are not immediately endangering another person's life, oftentimes the intervention of somebody with some mental health training can avoid a trip to jail, can avoid an arrest, can redirect that person to the resources they really need. We hope to do that. I mean,
That's awesome.
we've got to build the workforce that's available to do that here, and we're working on that. That's part of our program with UTPB. We've got another program with Midland College to get entry-level people into the behavioral health system.
Wow.
We'll set them on a path to doing jobs like those over time. So we've got a lot of workforce building to do before we can follow through
Yeah, but at
on
least
all
you're
these
doing
commitments.
it.
But that's part of it.
It's a big
If we
deal.
can get into a position where every call that sounds like it's got a mental health component to it can include a person with some counseling skills, then we've gone a long way toward de-escalating all that, keeping those people out of jail, and moving them toward treatment instead of incarceration.
That's a whole, God, I'd love to pick your brain over all that. That's fascinating.
It's a long way to go, and we still have a lot of work to do to make all that happen. But we have a lot of plans, big vision for it.
But at least it's something. I mean, it's, I think the biggest thing that I've learned in doing these interviews is learning that there are so many people that are trying. And they're trying
Right.
and they're showing up and they're trying to do something better for our community every single day. And I'm not really big on like insincere positivity. You know what I mean? I'm not
Yeah.
big on like, everything's great.
Yeah.
No.
No, it's not.
No,
It's not
but
great.
what I'm saying is
Yeah.
that when you hear the stories that we've been hearing, there gives me so much hope for our community because there are people that are doing it. Mr. Rogers always says when something bad is happening, always look for the helpers.
Right.
And for something as silent as mental health, we have to be loud about what our community is doing because it's already everything is done in isolation when it comes to mental health, it seems like.
This community is incredible, and I told you I came here 24 years ago now. Sort of because I was recruited, I didn't know much about it. I probably wouldn't have stayed very long if it weren't for the unique generosity of this community. When you show people here a problem, they step up and try to deal with it. And if you haven't lived anywhere else, if you happen to be one of those people who's really never been exposed to the rest of the world, it's not like this most places. We have a unique set of capabilities and an incredible willingness to help among people who have the resources to help. That we can just about do anything we can imagine if we just create a vision for it and a plan to achieve it. People will step up and support it, and that's what we're seeing in the mental health world.
That's awesome. I always like to ask everyone one question when we try to, wheel out, is what gives you hope for Midland?
Well, a lot of things, but that's probably the biggest one, that at its core, Midland is a community of people who are willing to give of themselves and of their often very substantial resources to make a difference in this community. It's a community that cares about each other and is willing to make sacrifice to make things better. And we see that manifested every day, and I don't see that changing.
That's so cool. Well, thank you so much for coming, Mr. Myers. I think that it's a wonderful thing that you've done for our community with raising money for the benefit of our hospital with your career as president at Midland Memorial, and now your current role as president of the Permian Basin Behavioral Health Center. You've raised money to increase our hospital's capabilities and expertise. You've raised money to help with our NICU development, and now this behavioral health center. I can imagine that you are going to help millions of people over such a long period of time. And I wanted to thank you so much for coming today.
Thank you very much.
Okay, thanks.